Welcome back to Phlebotomy Solutions, and in this PowerPoint presentation, we'll be discussing the infection cycle. So let's begin with a terminology of words in reference to the infection cycle. We have the droplet infection, which refers to the sneezing or nasal fluid that might be coming out. This is infection cycle that can spread through what they call droplet form. So if someone's sneezing, which can go up to 20 feet, or touches the nasal fluid from the nose and touches, these are part of the infection that a virus or any kind of infection can spread through that droplet form. We also have the incubation period. Now, this incubation period is referring to the time that the patient has the virus or infection, and that time that shows signs and symptoms of it. That in between phase is called the incubation period. So they require the virus or the infection, and the time they showed the signs and symptoms, that in between phase that showed nothing is the incubation period. And of course, susceptibility. Who is more susceptible to get the virus or the infection? That determines on their compromised immune system, which can be with children of infants to newborns who don't have a fully developed immune system yet, or geriatric patients who are immune compromised, as well as HIV patients or patients who already have another pre-existing disease prior to that. Their immune system could be compromised. As well as, now let's look at direct contact. This is where the patient directly contacts with you by handshakes or some kind of touching. This is referred to direct contact, and this could also spread the infection or the virus to the next person. Then we also have indirect contact. This is more of a third-party contact where it could be a doorknob or a handle or a silverware that you put in your mouth or touch. Sometimes these bacterial or viruses can live on a surface for quite a while, for a number of hours. So we got to be careful when we talk about these five, and we need to understand what each one refers to when droplet, incubation, susceptibility, direct, and indirect contact in the infection cycle. Now let's talk about the infection cycle chain. Now, as we can see here, there are 6 ways or 6 pathway that the infection cycle moves. One, you have to have a pathogenic organism or microorganism, as we can see at the very first. We also have to have a reservoir where this pathogenic microorganism lives or resides. Then we have to have what we call the means of escape, that how it leaves the reservoir and escapes out of it. And of course, in what way is that mode of transmission? It could be through drinking water or eating certain foods. And then of course, how is it entering? Is it entering through the mouth? Are you breathing it in? These are ways that we talk about means of entry. So again, we have the reservoir, means of escape, mode of transmission, means of entry, and of course, we have to have the host or susceptibility. Who is most likely susceptible person to this virus or infection? Is it an immune compromised individual? Is it geriatric patients? Or maybe it could be a newborn or an infant who has an underdeveloped immune system. So again, this is the infection chain of cycle that goes, and the only way this chain can be broken, the only way, is through proper hand washing procedures. That will break any chain of infection. Now, what are some of the growth requirements for a microorganism or microorganisms? Well, we have to have a good oxygenated area. We have to have moisture sometimes. Good nutrition in the area that the growth requirement for the microorganism might be, where it feeds off of. We have to have a temperature. Some microorganisms live in damper places, colder, or even warmer places. We have to have a darkness. In some cases, or even in most, darkness is a necessity for microorganisms. And of course, for a proper pH balance. These are, of course, the 6 things that are requirements for microorganisms to live. Now, not all of these can be in this order. You could have 3 out of the 6, or 4 out of the 6, or even 2 out of the 6. But these are the basic requirements: good oxygen, moisture, nutrition, temperature, darkness, and a proper pH balance were growth of requirements for a microorganism. Now, when talking about certain infection agents, there's usually typically 4 basic ones. We have bacteria, we have viruses, we have fungi, and of course we have parasites. Now, these of course are considered infection microorganisms that can live in any of those other areas we talked about. And they can usually spread sometimes, like we talked about, direct contact, indirect, or even in droplet form. So again, we got to consider the bacteria, virus, fungi, and parasites when we discuss infectious agents. Now, when dealing with infection control, we have to look at the standard universal precautions. Number one, we got to consider all blood and body fluids potentially infectious. Always. It doesn't matter who we're drawing or who we're looking at, if it's a family member, neighbor next door, we have to consider all the blood and body fluids potentially infectious. And that means we use personal protective equipment or PPE to prevent exposure. And again, it doesn't matter who you're drawing on. You must consider everyone possibly infectious. And of course, the slogan, if it is wet and sticky and it is not yours, do not touch it without gloves. So, what are some good control requirements for microorganisms that can actually prevent them from latching onto you or actually infecting you? Well, good physical condition and staying healthy is one. I mean, if we eat right, stay in good physical shape, that's one way. We can look at good emotional state. Stress has a lot to do with compromising the immune system. So, a good emotional state does help in controlling the requirements for microorganisms to attach and live and grow, as well as having proper exercise. A good with good physical, staying healthy with the proper food, proper exercise, even if it's just a half an hour a day or every other day. Proper exercise is good control, as well as good nutrition. Again, goes back to the eating. We have proper hygiene. This means bathing, daily if you can, or at the longest every other day. But typically, if you can, bathing or rinsing daily is great. Reducing stress. So we talked about having stress does affect the immune system and can actually help grow certain viruses or even bacteria in your body and spreading from there. So even certain diseases can come through stress, as well as this goes back to not eating correctly nutrition. Disease can form. Limit direct and indirect contact as much as possible. Dealing with patients, limited to just what you need to do. So if you're drawing blood, just draw blood. There's no point in having any more contact than just the drawing the blood. Or even with the indirect contact, that means restroom handles and doors or sinks. The less direct and indirect contact you have, the better the control. And of course, use standard precautions. This again goes back to PPE, protective equipment. Using your personal protective equipment and creating that barrier between you and the patient so that microorganisms do not latch on. And even having to wear masks, so if the patient does talk or has something that could be considered droplet, having a mask on so it doesn't spread. And of course, referring to infection control, the breaking the chain, washing hands before and after you handle a patient. Again, before and after you handle the patient, washing hands breaks any infection control chain. Now let's talk about the infection control sanitization. The number one infection control action is soap and water, and this is at the most minimal basic level. Anything else, as you can see from the picture, requires more of the heavy duty gloves when handling certain agents like bleaches or other heavy chemicals that require these protective gloves when sanitizing certain equipment that doesn't get disposed of. So whether you're washing your hands or handling equipment that does not get disposed of and using heavy chemical agents, of course, using your PPEs for those and your mask as well as soap and water can break any infection chain cycle. Now let's review. How are infectious agents transmitted? Well, we talked about improper hand washing, which is the number one chain breaker of the infection cycle. Proper hand washing does it all. And then, of course, contaminated instruments. Handling instruments that have not been contaminated by bleaches or rinsed or washed down. This is also how infection agents are transmitted. Body fluids, we talked about the sneezing, the droplets, but also dealing with blood or certain fluids in the body, urine. These are also infection agents that can be transmitted. So body fluids is another. And of course, through needle sticks. This is one of the areas where we need to be careful because a needle stick, a used needle that you stick yourself with, can transmit an infectious agent into your body. So if you ever get stuck with the used needle that you just use on a patient, then you must get to your do the protocol of the hospital or the clinic or the lab you're at. Follow the protocol because you're going to have to get checked out yourself and the patient to determine if there's anything infectious that was transmitted. So again, improper hand washing, contaminated instruments, body fluids, and needle sticks. These are all how infection agents can be transmitted. For more information, please visit Phlebotomy.
All right, so I want to take a little time and talk about the infection control video. Now, I know that we're all adults and we know that, there is a possibility of catching an infection. I'm sure you heard of bacteria, you heard of viruses. The common cold is a virus. We should know now that once they found out what COVID was a virus. It's just that when it first came out, it was one of those detrimental type viruses. So my thing for you is to be sure that everyone understands how infections could be spread. And even though you take this personally and you take this professionally, that way, when you're at home, not at work, and you'll have a different insight on how infections can be spreaded. So, for example, when COVID first came out, they told us to stand 6 feet apart from one another. They told us to wear a mask. So if someone coughs or sneezes, and if they are contaminated with the virus, we have better probability of not catching it because we were 6 feet apart and we had a mask. Okay. Wash hands. When COVID was out, I'm sure they said, wash your hands, because our hands is the first line of defense. Whether you know it or not, you can rub your eyes with your hands after been working all day, or even let's just say right now, before you start your new career, you may handle money a lot, cash money, or you may touch on things a lot at work. Even though you went to the restroom, you wash your hands, but you're back working. You're not working with patients, so to speak, but you're handling things. So you may pick up something and on your hands that you're not aware. That could be a virus, a germ, a parasite, or fungus. Fungi is the same thing as fungus. So what I'm saying is we have to be mindful. So per this slide, it says that there's droplet infection, and I'll go more into detail when I do CPR with the different infections, because let's just say right now, as you're learning to be a phlebotomist, you're drawing that patient's blood or helping the patient to collect their urine, their poop, their saliva, their mucus before you even know if they even have something. So just imagine that if you were a phlebotomist in the hospital and you on admission, meaning once they were admitted into the hospital, all of these blood samples and bodily fluids were taken. And now they're being hospitalized for whatever reason. So they're in the hospital for a few days. And so you are a phlebotomist in the hospital. So now you see a big sign on the door that says caution before you walk in. So I'll talk to you about what to do when the patient has been diagnosed with having a bacterial or a fungus or a parasite that can be contagious. But right now, I want to teach you to how to prevent being in contact for yourself, because you never know. You never know what a patient may have. You're going to be around people all the time. Okay. So we want to be sure, because sometimes a patient could be sick and it can be hiding in their system, lying dormant, being in an incubator phase. So, for example, how they said COVID, somebody may have COVID and don't realize it and then come in contact with you and you can still catch it before they even know. So we want to be mindful when it talks about direct and indirect contact. Okay, you and me shake hands. Let's just say, something is going on to where I'm sick. We shake hands, we hug or something like that, and I cough or sneeze. We shake hands, and that is all direct contact. Because if I am that person that has that bacteria that maybe I don't even know about, or has that virus that is contagious that I don't know about. That means that if you are later on experiencing those same symptoms, that means directly you caught it from someone. Now, when it goes to indirectly, let's just say we back on me again. I like to use me as examples just because, without pointing out, anyone, just so you can understand. So let's just say we back on me. Let's just say I have a cold of some sort. I think it's just a regular cold, right? A lot of people nowadays, when they cough and sneeze, oh, I have allergies, or my sinuses is messing up, or I just have a little cold, because everyone looks at everyone now that COVID's out like, oh my God, what's going on, right? Let's be real. We all think that at times, or you're around someone that may think that. But even though it could be something simple, sinuses, allergies, a very slight common cold, but nowadays people think bigger, right? So indirectly, let's just say I washed my hand, even though I was in the restroom, or let's just say I was in the restroom and I did not wash my hands, which, keep in mind, some people do that. So that's why you have to be more mindful. Someone went to the restroom, did not wash their hands. They touched the doorknob going out. You coming in, you touch that same doorknob. Let's just say later you're sick with something. So that means indirectly you did catch a hold to a germ, meaning that you did not directly catch it from someone, but that someone who had that bacteria or fungus or germ touched that doorknob or that faucet handle, anything. And that means indirectly you caught that. Okay. So I do want you to know the difference between direct contact and indirect contact. It sounds pretty simple. So I hope you don't, confuse it with each other or vice versa. So right here, what it talks about the infection cycle. Remember, I will test you on this, but the major big exam don't go into detail with the infection cycle. I just incorporate it in my curriculum because it'll be on my conscience if I don't include this in my curriculum, meaning that you'll be in the healthcare field. You'll be a phlebotomist dealing with all bodily fluids. So you just need to know how infections start, okay? And it can help you later. For those of you that's proceeding on, going to nursing school and so forth and so on, this will help you understand a lot of things. Okay, so first thing is first, we start with the pathogenic microorganism. Microorganism just means, is it the bacteria, the fungus, parasites, the virus? Let's just say the germ, okay? Now, let's just say all of a sudden, the germ comes from out of wherever it came from, wherever it's there. So then it jumps in a reservoir. Another name for reservoir is, where is it living? It was created here, and then now it goes somewhere to live, waiting for you. I'm just kidding. So it's waiting for you, right? It's living somewhere. So then after it lives, it finds a way to escape from where it lives, basically. So that's what it says about means of escape. So once it escapes from whatever area it lived in, now it escaped. So now it's wherever to try to actually find someone so it could be transmitted. So once it escapes from the reservoir, it's here, and then it goes to a mode of transmission. So let's just say someone caught, let's just use COVID, for example. Is always a good example because everyone should be very well aware of COVID. Let's just say COVID started, okay? For example, okay? It was transmitted some kind of way into your lungs, into your respiratory system. That's how come when they say when someone cough or sneeze, and if they're sick, you want to be away from them, so to speak, technically 6 feet apart, okay? Because they can cough or sneeze and then it's living in the air. So now the means of entry is you breathe it in. You took whatever that was out of the air without even knowing, and you breathe that into your system. So now it goes to the host accessibility, who is susceptible. So if your immunity is not up to standards and you're not as healthy as what you think you are, you could have breathed this in, breathe that air that had that germ from that person, breathe it in. And so now, because you are susceptible to it, now you caught it. Okay. So it could be from anything. You could have touched it. You could have breathed it in. You could have used a utensil like a fork or a spoon. You know, I'm not trying to be gruesome or awful or, nasty at any means, but if you see, that's why a lot of times you go to a restaurant, if you see the spoon or the fork is not cleaned good, most of us ask for to-go forks or whatever, or send it back. So just think of things like that. Now, I know, again, I'm being harsh, and I know that we're talking about infection, but I just want you to have an understanding how things simply can be transmitted. Okay. So we want to keep in mind, let's just say your patient gave you back that specimen container that you had her collect urine. You don't know that she has any bacteria in her urine, but let's just say it's spilled all over the ground or the floor. And so you're like, oh my God, I got to get Ms. Chopin to give me another sample. You give me another cup to hope that I can go to the restroom again. But in the meantime, you have to wipe up that floor. If you do not wipe up that floor properly, okay, and you go home and come back, you may not be able to see the bacteria. But let's just say someone drops a glove. It's a clean glove. You drop it on the floor. You think the floor is, immaculate. You put it on your hands. Simple. Now you have things going on your gloves that's supposed to be the first line of defense to protect your patient. So if a glove drop on the ground, no matter what, throw that away, get another one. Same thing. If a Band-Aid, if a 2x2 gauze that you're going to learn this weekend falls on the floor, even though you feel like everything is clean, you did not waste no urine, you did not do anything, okay, still get something new, because you don't want to jeopardize your patient or yourself for being contaminated with any germ. So this is considered the infection cycle. You need the actual germ to start it, which is another name for pathogenic microorganism, which is the actual germ. Then it has to live somewhere. Then it has to escape from where it lives. And then it jumps on something so it can be transmittable. How is it going to move? And then once it's transmitted, then how does it enter someone, to show that they are sick or have symptoms, or the bacteria is there? Sometimes people have no symptoms, and you may draw their blood, or they may swab their throat, and then they have strep throat. That is a type of bacteria that lies on the throat. You didn't even know it, but your doctor, because you were coughing, you went to the doctor, they did a COVID test, they swabbed your throat, they did a full type of workup, and then all of a sudden you come back with strep throat that you didn't think you had. Well, that is a bacteria lying on the throat. Urinary tract infections that we're going to learn in class, that's bacteria in the urine. It got in there some way, somehow. Okay. Some people don't wipe properly. Some people eat things and it just builds up, so different things that I will go the extra mile to kind of help you to understand certain things. So as a phlebotomist, I just need you to understand the infection control cycle. Okay. So moving forward, I need you to understand, how does these germs live? How do they multiply? And they multiply, this is how they grow. Different germs, bacteria, viruses, they grow with having oxygen. Okay, they grow with moist. Germs, if there's anything that's moist or wet, and if a germ is there, it grows even more. Okay, nutrition. If they attach to you, whatever the germ is, I know I'm making it seem like it's a person, but I am talking about a germ or bacteria. Sometimes they have to have different nutrients to eat, just like anything. We have to have nutrients that we eat to grow, to be healthy. Well, that bacteria also needs the same thing. Temperature wise, normally if it's hot and if there's bacteria floating in the air or whatever the case may be, it can multiply. That's why 100% of the percentage is when you go into clinics and hospitals, they're supposed to be a little bit over, like you may say, oh, it's cold in that hospital. It's because it's sick people there, and germs live more in the heat. So it should be of a cool statue. So therefore, germs wouldn't stand a chance living in the cold, okay? And also proper pH balance. I'll talk to you more about that when we dip urine, but this is how germs live. This is what keeps germs living, okay? Now, I already mentioned bacteria, viruses, fungus, and parasites are all examples of different germs. We're saying germs just to be easy with it, and because that's what it is, you know. It's just that when we talk, we say, oh, you know, oh, you got a germ, or what's going on? You, oh, I don't want your germ, right? But that germ has a name, and it's either like bacteria, virus, fungus, or parasites. And right here under microorganisms, it says you could be exposed to ingesting, meaning you ate it. You know, you use a fork or a spoon and you ate it. You know, you didn't know. Injection. It can be done by a shot or a needle. You know, if that needle is contaminated, meaning it's a dirty needle, or you didn't clean the skin of the patient properly, that we're going to talk about. And you can inhale that microorganism, that germ. Just as I mentioned, someone that coughs or sneeze, and if they have that certain bacteria coming from out of their lungs, then it can float in the air, and therefore now you have, you know, you can be susceptible to it. Okay. So I'll bring up certain situations later, but I just want you to understand. Now, this is most important. From now on, I need you all to recognize this standard universal precaution, this terminology. If I ask you, we may come, when we meet Saturday, I may just randomly pick someone and ask them, what is standard universal precautions? I hope that you can tell me that's because we are wearing gloves all times, because we consider all blood and bodily fluids potentially infectious. What it means is that you don't know if your patient have anything, but because you don't know that, you always wear gloves, because you want to use the standard universal precautions, because you want to use gloves because you're thinking, you have that mind frame that all bodily fluid from your patient could have a germ. That's why we wear gloves, okay? Before you take that specimen cup from your patient, make sure you have gloves, because you don't know what was on his or her hands when they touched it. Or if they went to get urine, they probably spilled urine somewhere on that cup. I'm just being honest, okay? You will deal with urine as a phlebotomist, okay? So standard universal precautions. Consider all blood and bodily fluids potentially infectious from your patient. We always want to use personal protective equipment. The abbreviation for it is PPE, personal protective equipment, and gloves is one of the personal protective equipment. I'll talk to you also the same day when I go over CPR and standard the other precautions. When someone does come back that they have something, I will explain to you all the different PPE, because there's gloves, there's masks that we know now, there is goggles to protect your eyes, there we put on gowns. So I'll explain to you later on in what way and why would you have to put on that other stuff. So right here in blue, it says if it's wet and sticky and if it's not yours, do not touch it without gloves. I don't even want to see if it's not mine or whatever. Just always have on gloves, okay? Wash your hands before and after each patient. You wash your hands, put on gloves. Once you're done with your patient, you take off your gloves, wash your hands, and then you be ready for the next one. So all that's just telling you to carry your nice Bath and Body Works lotion in your pocket, because your hands may get dry because you're going to wash your hands so much. And that's just how it goes in the medical field, okay? Not Bath and Body Works per se, but whatever lotion you use, because of course your hands can get dry throughout the day, okay? So be mindful of all of this, okay? And right here, it just talks to us about what I think that we already should know, is that we need to be in good physical condition. We need to be in a good emotional state. We need to do proper exercising. You know, I need to get better at that. We need to eat well, good nutrition, proper hygiene. Reduce any type of stress. We need to limit direct and indirect contact. I'm going to always say and teach to you. You're going to hear me say it over and over. You're just there to draw your patient's blood. Get them in, get them out. No, don't talk about what they're going to do on Thanksgiving. You know, get them in, get them out. You want to, that's all you're going to be doing is drawing blood or instructing them how to collect their urine, get their urine from them, and now they're gone. So try to limit your direct contact with them, because when you learn how to draw blood, what we're going to do in class, you're already going to be somewhat in your patient's personal space because of how you have to be close to draw blood. So when you limit your contact, do what you got to do, get your patient in and out of there, just keep it moving, okay? And last but not least, what we just went over, make sure you use standard precautions. Standard universal precautions is all the same thing. Standard precautions, universal precautions. That means standardized or universal wise, everybody has to wear gloves. That is a standard need, okay? So this is what is required for us to just, you know, have good immunity. Therefore, if anyone is lacking this, and typically people, when we get sick, some of this stuff starts to go. We have stress on our body. You know, good nutrition probably is not there because we may not feel like eating. So a lot of times it's easy for someone to catch something because now your immunity has dropped. So that's how infections start and different things of nature. I'll talk to you later about the difference between disinfecting or cleaning the skin versus cleaning the floors and tables. We always want to use alcohol for our skin, but if we're cleaning the floors and decontaminating the floors, I'll talk to you again more in detail that we want to always use a solution that has bleach included, because that's what kills and decontaminates the surfaces. But when we clean the skin, because I'm going to teach you, never break through a patient's skin with a needle until you be sure that you did clean it. And it's a word for it that we're going to talk about on Saturday. I don't want to bring up too many things out of order, but we always have to clean the skin. So I will be sure to let you know, okay, on the difference between the two. Okay. Any questions regarding infection control? Like I mentioned, this is for your personal knowledge as a healthcare professional. I will quiz you on my quiz, but on the big national exam, they're not going to go into detail with it. But I think it's fair for you to understand how infections, you know, are started, because you're going to be dealing with all type of bodily fluid, and it gives you insight, you know, in your personal life. You know, you may see someone and be like, "Oh, wash your hands," or something like that. Okay. So without further ado, if you do not have any questions, I want to go to my next video that's not as long. It's about 3 minutes, and it's over hand washing. Okay, I want infection control and hand washing to run simultaneously together because they go together. This is a video from the CDC. Remember, we went over CDC on Tuesday. CDC, the Center for Disease Control and Prevention. So therefore, they are the governing body that tells us how to properly wash our hands in order to prevent getting any type of diseases that may be out there. Okay, so keep that in mind. Remember, if you have a question, come off mute or send me a message in the chat. I will definitely be looking. Give me 1 second. And after this video, I'll start doing talking on other things. Hopefully you're all still there. You're still with me.
Yes, ma'am.
Okay. And remember, your first quiz is tomorrow. So a lot of things, thank you, Miss Martha. A lot of things that I went over on Tuesday and most of the things today is going to be on your quiz. So just remember, and I don't know if you heard it, but I am recording tonight's lecture.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great! No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit CDC.
All right, so that is a short and sweet type of video for hand washing. Like I mentioned, I know that we all know how to wash our hands. We wash our hands every day, probably multiple times a day. But in healthcare field, you just have to be sure. That's why a lot of times, depending on where you work, some places are okay with you having nails, but some places are not, because being in the healthcare field, germs can lie between or underneath your nails. And so you have to properly scrub them. So this right here are the steps to properly wash your hands. We wet, we form the soap to a lather. Then we scrub front and back of our hands in underneath our nails. Then we rinse thoroughly. Make sure we remove all the soap, all the lather, and then we have to dry fully, thoroughly. Because if we do not dry our hands, let's just say, we're at the movies, right? And you go to the restroom after the movie, and most places, or now places, are turning into the little blow dryers. Either they have napkins or they have blow dryers. Let's just say this movie theater, is still old fashioned and they have napkins, but let's just say there's no napkin in the dispenser. That's, that happens in real life. So there's nothing else to do, but depending on what you feel that you would do, I don't know. But let's just say if you're a person that will say to open up the door maybe by 2 fingers because there's nothing else to do. I said all that to say is, if your hands are wet, remember we just talked about the infection control cycle. What if indirectly someone didn't wash their hands and it was a germ, so to speak, on the doorknob? You washed your hands, you didn't fully dry them, but you still some way, fashion touched the doorknob. Well, now that germ could be back on your hands, and your hands are wet. So without further ado, just be mindful to make sure your hands is dry. Let's just say that situation really does happen to you in real life. I don't know if you are one that keeps sanitizer on your body, on your person, in your purse, like me. But if that happens, because some restrooms are not equipped, they can have a blow dryer and then it's broken. You know, you never know. So if that was to happen, then you try to do what you can to dry your hands to the best of your knowledge after leaving the restroom, or you could just simply take that sanitizer and go over your hands, because that sanitizer is going to air dry anyways, and then you'll be good until you can get back to wash your hands again. I'm not telling you that there's germs everywhere, but you just never know. So I just want you to be mindful, you know, and that's why a lot of times children, kids get sick. Let's just say, you know, they were birthed and they're newborn. They've been at home for 3 months, but let's just say mom and dad have to put their babies in daycares. Now they're around other children that have different germs from their house or from the daycare. That's why you always see children with runny noses and things like that, because their immunity is low and they were not in a daycare. You know, they were at home for 3 months. Okay. So I just want to just give you a little bit of insight, and I like to give different scenarios so you can remember. This will be on, this will be on my test, and this will be on the national exam, because this is a form of infection and safety. Hand washing is very important. If I ask you what's the first line of defense against germs, I hope you tell me hand washing. If I ask you, okay, what is it called? What is it called? If I tell you, you have to consider all persons' bodily fluid to be contagious with some germ. Hopefully you could say standard universal precautions, or universal precautions, standard precautions. You're just taking precautions because you're assuming that everyone has that germ. And this is proper hand washing. You may also work somewhere, ladies, where state may come in a building, or some type of organization may come in a building to inspect the building. And you, as the coworker, they may pull you to the side and ask you to demonstrate hand washing. Simple. I think it's easy peasy, but if you remember, wet your hands, lather the soap, scrub real good in front of them, overindulge them a little bit. You know, let them know you know what you're doing. Rinse your hands and dry them. Okay. The video said it's 20 seconds. Singing a happy birthday song 2 times is technically 20 seconds. I'm not telling you to go to the faucet every time you wash your hands and sing the happy birthday song, but in your brain, you want to do it, or you'll do it so much, you'll know what 20 seconds is. Okay. Back to the drying real quick. Some people dry their hands underneath the faucet with their hands like this. That to me means water is coming down here. So when you go to, rinse. When you go to rinse your hand, instead of having your hands up on the faucet like this, have them downward, because that way when the water hits your hands, it's flowing downward back into the faucet. Okay. That way you don't have water rolling down. Okay. That's just per the scope and per the book. So if anybody ever was to ask you to demonstrate it, then you do that. Of course, you know, once you get experience, people do what they want to do because you're working fast and you're going between patients. When we're in person, I'm going to explain to you the book version and the in-person version, because let's be real, we do have in-person type of techniques we do, but we also have to know per the book. Okay. All right. Any questions regarding hand washing?
No.
All right. Simple, right? I think we're moving forward. So let's talk about professionalism within healthcare or as a phlebotomist. Give me one moment. I want to share my whiteboard. The information will start to get more challenging, but the way that I'm instructing and teaching, I will still keep it the same pace. So I just want you to know that I will still keep it, and I will go over stuff over and over. Okay. So in your books, professionalism is talked about on page 12, 13, and 14. I know that we know how to be professional, but this is another type of infection control type situation. I just want to also make sure I explain to my students, because being a healthcare, I think I mentioned, it's not for the weak, right? You have to be a strong-minded healthcare professional. But also being a phlebotomist is not for the weak. You have to have patience, because when your patient know that you have a needle, and if it's a child, you know, like most children are scared of needles. Some adults are, you know, they may say, wait, give me a second, give me a second. So you do have to try to keep in your frustration, try to be patient, because, you know, you have those days. You will have those days. Wherever you work at now, I'm sure this is the same characteristics you have to oppose, no matter if it's healthcare or non-healthcare. It's just that it starts to get more challenging when you're in the healthcare, because other people's feelings are involved. You don't want to be that person that don't have good, what we call bedside manner. You may have walked into a clinic and that doctor just don't respect your feelings or don't care about your feelings, and you leave and you say, oh, he just rushed through my questions, he didn't talk to me, blah blah blah. So it's the same thing, and healthcare is changing. This is my opinion. We're getting more and more healthcare professionals, I don't care if it's doctors, nurses, that some of them go to work just to go to work, and they don't really show compassion to their patients, you know. So I do want to be sure that we all understand. Okay, so being a phlebotomist requires being professional. So on my green sticky note here, it explains the difference between professional and personal. So I want to explain it to you, and of course, screenshot the whiteboard if need be. It's also in your book, but that way you can kind of keep, you know, maybe your notes close, so you'll be able to remember to go check out page 12 and 13 and 14 in your book. So professional means having to do with work or on your job. If you are getting paid for it, you need to be professional. I don't care if it's your own business. That's even much more reasons to be professional. Okay, so if you're getting paid on your job, you want to be professional. The difference between professional and personal is personal refers to life outside your job. Have you ever heard somebody say, or are you the one that say, I'm not at work, I'm off the job, I don't have to be professional? You know, you have a balance to you. You know how to be professional and you know how to be relaxed. So don't confuse the two. Don't be relaxed and take your personal frustrations at work out on work, and then now it messes up your whole mode of being professional. Okay, so then when I go a little bit further into professionalism, it means in behaving properly when you're on the job. Okay, you're professional, you're like, I can be professional. All right, now are you showing professionalism characteristics? Are you behaving properly on the job? Yeah, you know how to be professional. You know what professional is, but are you behaving as a professional? So this includes being on time, dressing appropriately, speaking well, completing tasks and reporting to your supervisors as needed, and performing all your assigned duties that was given to you in your job description. I have a turn on and turn off switch. People tell me, oh, you turn off your work voice, because I'm so used to talking in my professional voice. Sometimes I forget. My brother tells me that all the time. Talk to me right. I'm like, what am I doing? So it's a difference, you know, speaking well, dressing properly, and you never know who's watching. I have a student, matter of fact, she's going to be our guest speaker. I always have a previous student talk to my class that is working, so they can tell you how was their experience taking my class, how long did it take them to find a job, how is their job, and I like them to be transparent just like me. So she told me, this has been maybe about 4 months ago, and they put her in a different position, which was a better position that actually gave her $1 raise because of how professional she was. She thought that she wasn't as good on her job because she wasn't sticking as many people as the other phlebotomists. But it doesn't matter. She handled her patients well. And so they promoted her. I mean, she still sticks patients, but now she kind of does extra duties. And without me saying a whole lot, she'll speak to you all about that. And that way you can ask her questions too. We're very open and transparent. But back to professionalism. These all are characteristics of behaving properly when on the job. It's not my responsibility. It's my responsibility to teach you and remind you how to be professional. But your supervisor or your manager can come up to you any moment, you know, and say something about, or you're not dressing properly, or you need to take your piercings out, or you need to wear a long sleeve shirt because you have too many tattoos. Not too many places do it now because things have changed, honestly. It really has. But if they do, they'll tell you that in new employee orientation or on your interview, and you just have to adhere to it if you want to work there until you become your own boss. And by the way, when you're a phlebotomy technician, you can start your own business as your own mobile phlebotomist, but we can talk about that later, okay? So moving forward, on page 13 and 14 in my purple sticky notes, there is different characteristics of being professional that you need to keep in mind. So in order to do your job well as a phlebotomist, you must have or develop certain qualities as a professional. And so this is where I'm gonna go over all 7 qualities, but I'm gonna read it from the book just to give you insight. Remember, you're gonna have your book, and it's explained on page 13 and 14. So number 1, you wanna show your patient that you have empathy. What does empathy mean? Showing empathy means identifying with the person, your patient's feelings of others. People who are empathetic work to understand other people's problems. They care about them. Many people find needles and medical settings in general to be frightening. Patients may also be fearful about possible diagnosis. You know, they don't want to hear the bad news. So approaching patients with empathy is a key part of phlebotomy, a phlebotomist's job. That's the first good quality of having a bedside manner. Because that patient could have just finished talking to the doctor, and the doctor said, I'm suspecting this. It could be this, it could be this, but we have to get your blood work to make sure. That could be some bad news for that patient. So now they're coming to you to get their blood drawn. You have nothing to do with what the doctor told them. It's not your job to explain to what the doctor told them. It's not your job to explain what tests you're doing to them. Your job, your scope of practice is just to draw their blood. And I'm gonna also explain to you how to talk to your patient to make sure that you have the right patient and things. But what's the nurses and the job, the doctor's duty, you don't do. But you just show empathy. You know, how you doing today, Ms. Chopin? My name is, you know, Akila. I'll be your phlebotomist today. The doctor has ordered blood work. Okay, go forth and go on. You're talking so sweet and nice to me. It may help me to forget all what that doctor told me. Okay, so be sure to try to show empathy, and you will get better and better with experience. Okay. Number 2, you want to be honest. An honest person tells the truth and can be trusted. Patients need to feel that they can be trusted. That they can trust the people who care for them. Employers count on truthful records of care provided. So this is an example for, let's just say you get a 13-year-old that you're drawing blood on, and she asks you, is this gonna hurt? I hope you don't tell her yes or no, because it may not hurt to her, or it may feel like it's killing her. You tell the patient, they'll feel a stick. Okay. You just be truthful, because some people, even when I went through nursing school, I would hear some people say, you're going to feel a little stick. Little, it may be little to you, but that's big to me. Just be honest as you can. And that's another thing that you'll learn by experience. Okay. Just be as honest as you can within your scope of practice. Again, if the patient asks you, well, why did the doctor order this on me? Why did he? Do you know why? That's not your job to explain it. You can tell her what the test name is, or tell him, but you can't explain to them why the doctor ordered it. If they're having so many decisive changes They may not want their blood drawn today. They may want to go talk to their doctor. And I'll explain that to you on Saturday, because when we go over consents, because you have to be sure that the patient has your understanding before you stick them with the needle. Okay. So be as honest as you can. Remember, no matter where you work, they're going to put you through orientation and training. So you're going to know your job's ways and how they want you to act. Okay. But we still want to be honest. Number 3, we want to be conscientious. Conscientious people try to do their best. They are guided by a sense of right and wrong. They are alert. They are observant. They are accurate and responsible. Giving conscientious care means taking responsibility for one's actions during each patient interaction. Accuracy in performing procedures, care with infection prevention and safety, what we just talked about, and appropriate interaction with patients are all aspects of providing conscientious care. So in so many words, you know what's right, you know what's wrong. You're going to be taught what's right, you're going to be taught what's wrong. So hopefully you're that kind of person, even right now in your everyday life. Like you probably be like, oh man, I said the wrong thing to her. I feel bad. Let me go and apologize or something like that. It's weighing on your shoulder. So as a phlebotomist, you want to be sure to try to have that characteristic, you know, of being conscious. You know what's right, you know what's wrong. If you felt like you did something that wasn't appropriate, then, you know, be sure to acknowledge and accept the, you know, accountability of your actions. But you know, it's just as simple as that. As you learn how to do the role of phlebotomy, it'll just roll off your tongue. But if you're that kind that expect, we're all not perfect, but if you're that one to expect perfection and want to be as accurate as possible, you are observant to your patient, then you're that person that is, you know, always conscientious. You want to do what's right and you know what's wrong. So, okay. Any questions? I don't know if I hear somebody. Okay. Now, number 4, being dependable. We're supposed to be like that on every job, okay? You want your manager to know that you're dependable, that they can depend on you. Especially, you know, this is a job, this is a career-based job. You want to show out. I'm dependable. Being dependable as a phlebotomy technician must be able to make and keep commitments. Must be able to make and keep commitments. They must report to work on time. They must skillfully perform assigned tasks, avoid absences, and help their peers when needed. Okay, that's just straight and simple. I think that's on any job. You want to be dependable. If the roles were reversed and you were the owner, you were the manager, you were the supervisor, you want to have a dependable staff so your location can show out and improve and show out. Okay, next, number 5, you want to be patient. As I mentioned earlier, people who are patient do not lose their tempers easily. They do not act irritated or complain when things are hard. Patients may be anxious, sick, or in pain. They may be hesitant about even having their blood drawn. It is important to the technician not to rush the patient or act annoyed. I ain't gonna lie to you. In your inside person, you may be annoyed and you may want to rush, but that's part of healthcare. You just want to let the patient know that right now, while they're sitting in your chair, you're taking time out. Now, they may be situations that you would have to use your own judgment. Now, if 20 minutes then went by, that's still too long. If 20 minutes then went by and this patient is so anxious and say, wait a minute, I'm not ready, you may have to take a break from the patient real quick. Okay, let me give you a little time, Ms. Chopin. You want to go, you want to sit in the lobby? Because they're taking up your time. You know, your inner person is like, she needs to go or he needs to go, right? But you just don't show it. So you can still make the patient feel, you know, comfortable by saying, okay, you may need a little bit more time to show pain. Let me just have you wait in the lobby, okay? So therefore I can go ahead and, you know, tend to other patients and then check on you. You'll figure out how to talk. You may have to involve your supervisor. On every job, you're gonna have a supervisor. But without further ado, you wanna always be patient with your patient, okay? Next, number 6, you want to show respect. Be respectful. Being respectful means valuing other people's valuing other people individually, including their age, their religion, their culture, their feelings, their practices, and their beliefs. People who are respectful treat others politically and kindly. They avoid negative conversations and gossip, literally. I don't know. You may work with somebody right now that every day they come to work, they talking about somebody. And then you thought, you know, we friends, I'm gonna go ahead and listen. But then every day they kind of get on your nerves. I used to work a couple of places like that. And so you have to disassociate yourself. I mean, of course you use your judgment, you know, depending on how severe it is, but you want to give your all to your job as you need to do. You want to be respectful to your patient. Okay. And a lot of patients, there are certain people that have different beliefs. They have different religions. So if they tell you something about their religion that, you know, it could be something, you just respect them and then, you know, do as they want. If it's something that's outside your scope, always be mindful to reach out to your supervisor. Okay. But without further ado, we have to be respectful. Number 7, last but not least, we need to be a healthcare professional that is unprejudiced. Rather, you have some kind of prejudice issue, hopefully you don't bring it on the job. This is a characteristic of being professional. Be unprejudiced. Unprejudiced means phlebotomy technicians work with people from any and many different backgrounds. They must give each patient, the same quality of care regardless of age, gender, identity, sexual orientation, religion, race, ethnicity, or condition. So just be unprejudiced. Do what you came to do, okay? Do your blood draw, treat your patient kind, and just move on, because you're gonna be caught in situations. Now, as you get experience, you're gonna meet people. You're gonna meet people of different race. You're gonna meet people with a different background. You'll be like, oh, I never met a person like that. It may be intriguing to you. It may be interesting, because in healthcare, you're gonna see it all. You're gonna see a lot. So you just do what you got to do and you take it with experience. So therefore, when you get someone else that have the same beliefs or same things that you experienced before, you'll be able to understand it because you had a patient like that before. All right. So different qualities of being professional: showing empathy, being honest, showing conscientious, being dependable, being patient, respectful, and unprejudiced. Hopefully that was all well said and understanding. Again, it's on your page 12, 13, and 14 of your book, which is chapter 1. It's the very basics beginning of phlebotomy in healthcare. So I just want you to know that when you leave my class, finish my class, and is certified, try to exhibit all these characteristics of being a professional. And you never know who may be watching, and you can get promotions, you know, earlier than you expected just off of this. Okay. All right. Any questions?
No, ma'am.
Let's move forward. I need some water. Hold on one second. Thank y'all. All right. Now, quickly, I do want to go over this particular topic. And like I said, when it's all said and done, I feel like I'm blessed when I lead everybody to how they should be led. So you heard me say a minute ago that you can be a mobile phlebotomist, even start your own business, you know, when that time comes. And that's true. And I don't mind helping you, showing you the way, okay? And that will come in due time. Give me one second because my thing is all in my way. Okay, so right here, I want to talk to you all about where can you work as a phlebotomist. Some people really don't know that there is a multiple places that you can work. So when it's all said and done and I give you those resources and I do what I can to reach out to people that I know, you know, don't be surprised. It'll be in facilities that, I mean, it'll be in places you didn't really know. But before I do that, we'll talk about those things, okay? So The following are common settings that may employ phlebotomists. Physician offices, which is doctors, provider offices. It may be a small practice, a family practice, you know, let's just say you have a cousin that's a doctor. She or he has their own office. They may want to hire their own phlebotomist so they can do their own blood work there. Okay, you can work in a small doctor's office setting. Or you can work in an outpatient lab, which is your Quest, your LabCorp, your any lab test now, ultra lab tests. A lot of them do want you to have experience. That's why I'll talk to you later. A lot of my students do branch off to plasma centers and blood banks first for at least 6 months, unless you already know somebody, because sometimes it's who you know and they can help you get on brand new. But we could talk about that later one-on-one when we're all over. Okay. But outpatient lab is the patient walked into the lab to get their blood work done. It wasn't inside a doctor's office. Okay. Hospitals. You could be a phlebotomist in the hospitals. I don't know if you all are aware of the HCA chain. They hire brand new. Now, you have to take a deep breath because they say they hire brand new. I have 2 students that is working there, and they do hire brand new. But you know, sometimes some people, it depends. I don't know what they looking for, who they looking for. You know, it's sad to say, but some people be looking for a special look. I don't know why. I'm just being honest with you. But I am telling you that HCA hospitals, and an example of HCA hospitals, for those of you that may be on the east side, it was East Houston, but the hospital has been torn down. Clear Lake Regional is the HCA. Tomball Regional is the HCA. Women's something in the medical center is the HCA. You can always look it up. Out there in Alvin, Mainland is the HCA hospital. So they hire. Of course, you may have to step out your zone of where you live in the beginning. I always tell people, because if you're focusing on a particular area in this Houston to work, it may not come as fast for you. You may have to branch off. If you have appropriate transportation, you may have to branch off. But yes, oh, I forgot, Pasadena Bayshore. It's the HCA hospital. I used to work there in postpartum after the ladies have their babies. So you could be a phlebotomist in the hospital. And I think for a lot of people, that's people's ultimate goals. A lot of people want to work in a hospital because they're probably going to school for other things and they want to be exposed. Okay. Also, urgent care centers. There are so many urgent care centers popping up nowadays. They're called patient ER, or it'll say urgent care, or it'll say whatever. So you may want to look them up on the website, and you can start looking them up before you're even done, because you want to get an insight on where phlebotomists can work and who's hiring, how often they hire, things like that. So urgent care. Nursing homes. You could be a phlebotomist that works for a nursing home now. I haven't met a nursing home or known of a nursing home that you could just walk in a nursing home and ask them if they're hiring phlebotomists. But there are companies that you can work for that goes to nursing homes. Those are mobile phlebotomists. You work for somebody, but you go from place to place drawing blood. Everybody has to have their blood drawn. So you can work for those type of places. Okay. Wellness clinics. What's the difference between an urgent care and a wellness clinic? Well, some places just have just a wellness, like you're not sick. You just go in there just for little checkups. And so they may need a phlebotomist to draw blood, okay? Insurance companies, not a lot of people know this, but some people who get life insurance, you have to be a certain age and they want to be sure you do not have any pre-existing problems or health conditions, because if you do, your policy amount is going to be skyrocketed, so to speak, or the amount is going to be different. So these are types of places where phlebotomists can work. Of course, when you off to the beginning, you have to start from somewhere, but you can always elevate and level up to different genres. Okay, so these are healthcare settings where phlebotomists can work, along with plasma centers and blood banks. Okay. All right. I just wanted to explain that so everyone to kind of have an idea. 7:44. Ooh, I talk a lot. Okay, so what I want to get into is the anatomy of the needle, because I want everyone to know about the needle before we meet on Saturday. And then I'll get into how to identify your patient. And then after that, we should be done, and we will start with the veins on Saturday after we do the equipment and all that, because you need to know the veins, okay? And just in class, I have a television. I show videos in class and pictures just like I do on Zoom. It's just that we're gonna be in person, so you will see my silliness for real in person, okay? So let me go ahead and share my screen and show you this image real quickly. All right, this particular image you will have in your folders. I still give everybody the same image in you're gonna have this paper in your folder. But by the time we meet, you should be comfortable with the anatomy of the needle, because I'm going to explain it really short and sweet. Okay. Now the needle has it's connected to a syringe and a plunger. Give me one second. Sometimes I'll be teaching from my office, but when I'm teaching from home, give me one second. I think I have. Okay, I don't have it, and I don't want to take too much time looking for it. But remember, on Saturday, I will give everyone one by one. When you come in, you're going to have stuff, just looking at you and saying hello. Everyone, you will look at it verbatim. You will be able to identify everything that I'm teaching now, even with the syringe. Okay. So without further ado, this is an image of a needle, though, but it's connected to a syringe. A syringe can be used, a needle that's connected to a syringe could be used for different things. If you're going, further in your career for nursing or medical assistant, or may want to do, I know Miss Martha is going into my patient care tech, we learn how to give injections, how to give shots. So that's where the medication goes. The medication has to go in the syringe in order to give an injection. I will also teach you that you can also draw blood using a syringe, and that's the syringe. The body of the syringe is where the blood goes in. I'll talk to you about that later, because that's for people that has small and fragile veins. Back in the day, that's how they drew blood. Okay, but now in the present day, we have a more formal technique to make it easy, to where you only get stuck one time and fill up multiple blood tubes. Okay, so this is a syringe. You have your plunger that goes in the barrel of your syringe. It squeezes it down or pushes it up. If the syringe is full of blood or medicine, the plunger will be all the way out. If the syringe is empty and there's no medicine, no blood in it, then the plunger will be all the way into the syringe because it's empty. Okay. Now, the body of the syringe you see here is labeled the barrel. The barrel is how you would know the measurements. I will show you in person. I'm not sure, but you all may have seen a syringe before. You may have given your children medicine. You probably gave yourself medicine from a syringe, or had a shot from the doctor. You've seen a syringe before. The body of the syringe is called the barrel, and it has the measurements. Is it 1 milliliter, 2 milliliter? It tells you how much the syringe can hold. Okay. But now, moving from the plunger, from the barrel, now we want to go into the needle. Okay. So where we connect the needle to the syringe, this intersection right here, is called the needle hilt or the needle hub. Most of us just say the needle hub. So when you open up the needle from its pack and you take it with the top still on the needle so you don't stick yourself, then you screw it onto the syringe at the needle hub. Okay, at the tip of the syringe to the needle hub, you attach it. Now, What I want us to key in on is the actual needle. So when I increase or zoom in on the needle, you see right here, it actually has the needle in a little circle in a magnifying glass. Sorry, I'm talking too fast now. In a magnifying glass. When we go back to the needle, you see this whole metal is the needle. The whole thing is considered the needle. Before we move forward, when I teach you how to draw blood, the whole needle does not go into someone's vein. It does not. It does not, okay? But the whole metal part is considered the needle. But now when we get to the magnifying area, I want you to know that there's 3 dynamics of the needle that's important. So we have the shaft. We have what's called the lumen, L-U-M-E-N. And the lumen, you see it points in the inside of this opening. So the lumen is the opening to the needle. How do you think if you get a shot, how's the shot going from the syringe into your muscle? If you're going to draw blood into the syringe, how is the blood going into the syringe? So it has to have an opening in the needle for those things to work, okay? So that opening, this opening is the lumen. But the difference between the bevel and the lumen, you see the bevel, which is spelled B for boy, E, B for Victor, E-L. I need you guys to know all 3. You see how it has this little parentheses over the whole opening. So the difference between the lumen is how big the opening is. The bevel is the whole opening. Hopefully I'm making sense to you. So for example, needles come in different sizes. So that lumen will be a different size. It'll be a small opening, maybe a medium-sized opening, maybe a bigger size opening, but the actual opening itself is called the bevel. Did I lose anyone with that?
No.
So what I need you to know about the shaft is so when we stick the needle into the vein, we're covering the whole bevel. You're not going to be able to see it again because it's in my vein. Then we insert the needle a little bit more to the shaft. So mentally, be prepared to remember that when you insert the needle, once I teach you, we got to go in steps. But once I teach you to insert the needle, you're inserting the needle into my skin just to the shaft, not the whole needle, as I said, okay? Some people come into class not really understanding and think that we put the whole needle into the vein. No, we just cover the bevel so the blood can have leeway to get in the needle. And then we go 1 to 2 inches further to the shaft. That's it. Oh, yeah, I hate that I don't have that needle here. Give me 1 second. I normally have a needle even if I'm at home to show, but it's okay. You will see it all in person on Saturday. Okay, you will see it all in person on Saturday. No matter the size of the needle, every needle has a bevel. And because the size of the needle, each lumen is a different size. So shaft is a part of the needle where we go. Lumen is the size of the opening, and bevel is the opening. Okay? What I also need you to remember is the bevel, and I'm going to say this many, many times, in order to have a successful blood draw, meaning that once you stick me, you get blood to return into the blood tube. That bevel has to be up, never down. So for example, that's why I wish I had the needle. So for example, when we insert the needle into the vein, that opening is looking up. That opening is not down. Because if you insert the needle with the bevel downward, the blood really has nowhere to go because it's downward. But when it's up, the blood flows into the veins. So what I need you to remember about the needle, that when it's inserted, we insert it into the vein until we reach the shaft. That means the bevel is covered. But when we're inserting that needle, the bevel is always up, not down. And on Saturday, you will look at your bevel. Everybody will have a needle of different size, and you will look at your needle, okay? Bevel, lumen, shaft. Bevel is the opening to the needle. Lumen is how big that opening is, and shaft is the shaft part of the needle that we're going to insert into our patient. The syringe is just a syringe. I just wanted to explain because you may have to use a syringe one day to draw blood. It's another technique that I will show. Okay, give me 1 second. Let me show you this. Bevel, lumen, shaft. That is the characteristics of your needle. Now, hopefully you see pictures of these needles. If you can come off mute and tell me what you see about these needles, what you see?
The different colors of them and sizes of the needle.
Okay, the different colors obviously represent the different size of the needle, which represents the lumen. Okay, now, perfect. But I'm looking for one more to complete it. What are you noticing about the sizes?
The thickness.
The thickness.
Yes.
Tell me about the thickness though. You're there.
The smaller the number, the thicker it is.
Oh, that is correct. So for all of you, yeah. So for all of you, you see, let's just start with the pink over here. It says 30 gauge, which is how big that lumen is, and it's a 30. But then when we go all the way to the end to this pretty green, because I like that green, I think that's my birthstone. When you go to this green, you see it says 14 gauge, which is how big the opening of the needle is. But if you go from the pink to the green, you see the pink is little. And then you see the green is bigger. But you also see the green says 14 and the pink says 30. So in real life, 30 is a bigger number than 14. But in needle life, the bigger the number is really the smaller the needle. The smaller the number is really the bigger the needle. Okay. The most average size that you're going to use to collect blood from a patient, even in class, I have new needles, the accurate needles that you're going to use, is 22 and 21. Those are the most average size needles that you're going to use in class and in real life to draw blood on people. And if I want to say which one is the biggest needle, out of the 22 and 21, can someone tell me which one is considered the biggest?
21.
21 is the biggest. Now, we will also use 23 in class. 23 is on a more smaller needle that you're going to see, and it's a butterfly needle. That needle is more smaller and thinner. But in other words, I want you to know, I need you to know, it's the basic fundamentals of phlebotomy when you're using needles. The lumen part of the needle represents how big the opening is. So the smaller the number, then that opening is huge. The bigger the number, that opening is small. I need you to know that. You're going to be tested on that in all ways, not just for me, but on national exam. So typically when you're dealing with needles, when it's different colors like that, it does represent the size. I will tell you in class, always read the labels. If you take it out of a box, read the box. Okay. If there's a label on the needles, read the label. Get yourself acclimated, because if it's coming from the same company, then everything is going to be the same. But you may work for this lab for a year, and then you went to a whole different lab. This lab may have used McKesson products, but this lab probably used BD Vacutainer products. So the color of their 18 size gauge needle may not be green like this company's was purple. So always be mindful to when you switch jobs, get yourself orientated and acclimated to theirs. But back to the needle. Bevel is the opening. It's always up. Lumen is how big that opening is. And the shaft is how far we're going to insert that needle into the vein. The bigger the size, the bigger the number is, the smaller the needle. The bigger the number that represents the size, that needle is small. The smaller the number that represents that size, that opening is huge. For example, I'm going to go over it again, but if you ever donated blood or donated plasma, they use big needles. They use 16, 17, or 18 gauge. Where is it to when we're drawing blood, we use 21, 22, or 23. That goes to show you that it matters in the size of the needle. Any questions when it comes to the needle? We're going to continue it on Saturday, but I may pop out some questions, okay? Out of 18, 20, 21, which one is smaller? Which one is bigger? You know, just to get you going, okay? What is the bevel? Should it go up or down? Okay? When you're visually looking at the equipment, that's when I will ask, because now you're looking at it, okay? So be mindful. The needle is a main component of drawing blood, okay? All right. Let's move forward. We're almost to the finish line. Now, this is going to resume on Saturday because, you know, I have to be sure that we all understand certain things. But it is important to properly identify your patient before you draw blood on him or her. So you have to always verify. So for example, I'm Juanetta Chopin, as it says on my Zoom thing. Some people pronounce my name as Juanita Champagne. So I'm used to people mispronouncing my name, right? So let's just say I go to lab and I'm in the waiting room and somebody actually really says Juanita Champagne, or the lab person or you as the phlebotomist says Juanita Champagne. I stand up because I'm thinking, oh, they mispronouncing my name like always, okay? But what if there really is a Juanita Champagne there? She's just in the restroom. But at this time, you have me. So it's okay. You don't know you have the wrong person yet. But when we get to your cubicle area that you know, draw blood on, before you even get started, now in private one-on-one, you have to identify me. And it is the rule of thumb. You can technically mess up, draw blood on the wrong person, get a patient misdiagnosed with any type of diagnosis if you do not properly identify your patient, okay? So depending on where you work, they may ask for you to always ask for the patient's ID. In class, we're not going to do that, but I'm just letting you know, depending on where you work, they may train you to say, okay, we ask for insurance cards and identification here. If they do, they do, because that's their place, okay? But let me go into this identification series before I let you guys go tonight. The phlebotomist role requires a professional, courteous, and understanding manner in all contacts with the patient. Make sure you greet the patient and identify yourself and indicate the procedure that will take place. Effective communication, both verbal and nonverbal, is essential. So, hello, Miss Michaela, my name is Juanetta. I'll be your phlebotomist today. The doctor has ordered, the blood work, and is it okay for me to draw your blood today? I'll talk to you more about it, but you do have to make sure that the patient has your understanding, okay? Effective communication. You can also say, start to talk to your patient. How's the weather? If you like this cold weather, that'll come over experience. Because the more you talk to the patient, it can ease the patient down. So you do want to communicate with the patient, okay? But before you get down deep, you have to identify your patient. So as it states, proper patient identification is mandatory. Always ask the patient for a full name during introduction. Make sure the patient you are about to screen is the patient schedule. Remember, you have the wrong patient. You don't know it yet, okay? Patient must provide identification other than the verbal statement of a name. So I could tell you all day long, I want Nita Champagne because you mispronounced my name. So I'm basically mispronouncing my name on purpose, because that's what you call. You can't take my word you can't take it for word. So that's why the patient has to have something, or you have to have something to make sure you have the right patient, which is why most places ask you to ask for an ID, okay? But in class, we're gonna do the requisition, which is the doctor's order that I'll show you before we go. Just give you a snippet that you'll all have a copy in your folder, okay? So that's how you're gonna identify if the patient is saying the right name, so you could be sure that you have the right patient, okay? So back to this. Patient must provide identification other than the verbal statement of name. Using the requisition for reference that we're gonna do in class, ask a patient to provide additional information such as a surname or a birth date. A government issued photo identification card such as a driver's license can aid in resolving any identification issues. If possible, speak with the patient during the process. The patient who is at ease will be less focused on the procedure. Always thank the patient and excuse yourself courteously when finished. So the moral of this is, in order to properly identify your patient, it's always two unique identifiers: the name and date of birth, first and last name and date of birth, not name and social security number, not name and what city were you born in. Always the name and date of birth. But moving more personal into it, never tell the patient his or her name. So for example, are you Juanetta Chopin? And then I'll say, yeah. You have to get the patient to tell you their name. So you would ask, can you state your name for me? I'll say Juanetta Chopin. You will say, can you spell it for me? Because remember, you have the wrong patient and our names are similar. I'm Juanetta Chopin and you called Juanita Champagne, okay? So I stated my name and now I'm spelling it for you. Then you realize when you look at the requisition, like, then you say, okay, can you state your date of birth? I tell you my date of birth. Then you look on the requisition and you realize you have the wrong patient at that point. So you didn't really mess up because you didn't stick the patient, you didn't move any further. You just have the patient go back to the lobby and then get your right patient. So the moral of everything is that please remember, it's very, very important. You're going to be tested 1,000,000 times on how do you identify your patient. And it is per name and date of birth. Get them to tell you their name and date of birth. Don't ever tell them. Because if you tell them, for example, okay, are you Juanetta Chopin? And I'm saying, yeah. Juanita Champagne, and I'm saying, yeah. Because I'm not telling you that you saying my name wrong, but I believe you have the right patient, okay? That's why you get them to state their name, spell their name, and state their date of birth, okay? Simple. 2 unique identifiers, name and date of birth. Can you state your name for me? Can you spell it? Can you state your date of birth? And that's it. Then you can move forward. And that's when we'll move forward on Saturday with what to do after that. Because by that time, you're getting your equipment out, you're talking to your patient, interviewing your patient with a couple of little questions. But first, you want to be sure you have the right patient. Okay? Hold on for me 1 second. This is a copy of what we call a requisition, and this is actually oh, what am I doing? Hold on, y'all, sorry. And that's my ice maker making that noise. Oh Lord, where did it go? Give me 1 moment. I don't know what I did with it. Okay, everyone will have a copy of this. And this is a sample of a real Quest. Quest is a real lab. And it's a big one. And they're all over. So when I tell you a requisition, this is, in other words, a requisition. This is what your patient will get from their doctor. And when they come to the lab, this is what they will bring to you. And up here, if you can see it, this is where this is what's going to help you identify your patient, because on the requisition, it'll be already filled out from the doctor's office, where it says patient's last name, first name, middle name, date of birth is here, whether they're male or female. All of this will be filled out. Okay, I will create a fake patient for you all, so you'll have an insight. But this is the requisition. When you say, can you state your name for me? I say Winetta Chopin. Can you spell it? I spell it. You say, okay, can you state your date of birth? And this is where you will verify. But like I said, in most places, you'll have the requisition and you will probably have to ask them for their driver's license. Okay. So this is considered a requisition. Now, I don't want to bust your heads wide open, but this is also how you would know what to draw on the patient. I'm not going to teach you every single last box, but what I will teach you is the most common test that doctors order for, like physicals and everything, that is also on your national exam. So I will basically help you to study what's the most common test. Then I will also have to help you to know what color tube those tests go in. We will do all that. Okay, so this is considered a requisition. This is how you identify your patient. Okay, with the name and date of birth. Always never tell them their name. Say, can you state your name for me? And if anyone has gotten their blood draw recently or have been to the lab before several times and you attest to what I'm saying, that is the scope of practice. You have to get them to state their name, spell it, and also state their date of birth. And before the patient leaves, when you label the tube, you also have to show your patient that their name is correct before they even leave, so they can be sure that their blood or urine or whatever has been properly labeled with their information. Okay, so we're going to see more of this. You're going to have your requisition in your folder. You're going to have your image of your needle in your folder. You know, at that point on Saturday, we're going to be looking at the equipment, you know, so you'll be able to see it. And like I said, I am a person that don't mind that you take pictures. So, you know, you take pictures of of the equipment we go over. Once I explain it all one by one, I will tell you, okay, go ahead and take pictures now so you can have this picture to reflect, because we'll go through the equipment one by one. You'll take your notes down, write it down, and move forward. Of course, you know what a Band-Aid is, an alcohol is, you know, but you still probably want to take a picture to be visual. Okay, now this is something that we already went over, which is my whiteboard. If you want to screenshot it, this yellow section we'll go over on Saturday, because after you identified your patient and when you start to get your equipment out, you want to talk to your patient. You want to kind of interview them and make sure that, you know, you're kind of avoiding any problems. So we'll talk about this later. But if you want to screenshot this, please do. But we'll go over these questions one by one on Saturday. But in my purple sticky note, we already went over how to identify your patient. 2 unique identifiers: name, first and last name. Get them to state their name. Also spell it. Also date of birth. Okay. I don't know why this can't change. It's still a 1. Okay. So that is how to identify your patient. Over here in this little pink sticky note, we talked about the needle. The bigger the number, the smaller the needle. The smaller the number, the bigger the needle. Example, 16, 18, 20. 20 is the smallest. The average size needle to use for average people is 22 and 21. For blood donation and donating plasma, they use bigger needles, which is size 16, 17, or 18. Okay. So I want you to screenshot this if you can. Therefore, when we go over it again, you'll be able to, visualize it, and you can also be looking over it until we meet on Saturday. 2 unique identifiers that we match up to the requisition. Something simple as Juanetta Chopin and Juanita Champagne can easily happen. There's other names out there that can easily happen. And behold, we're in the lab at the same time. You know what I mean? So be sure that you properly identify your patient.